Assalamu alaikum. Welcome to the channel. This is the fourth video of insulin course series. In this video, I would like to talk on what is basal plus therapy and when should be basal plus therapy started. So let's begin. If target HbA1c is not achieved with 24 units of basal insulin, then it may be because of uncontrolled postprandial sugar. You can start patient on basal plus therapy if fasting blood sugar is controlled but still HbA1c is not in target range. Short-acting insulin is used in addition to basal insulin in basal plus therapy. Suppose the patient is on 20 units of basal insulin, fasting blood sugar is controlled but HbA1c is still high. You will check postprandial sugar such as post-lunch and post-dinner sugar. If anyone, whether post-lunch or post-dinner, is uncontrolled, then this patient is a candidate for basal plus therapy. So remember this point. Formula for basal plus therapy is post-meal sugar divided by 36. Let's take the earlier mentioned case. Patient is on 20 units of basal insulin and fasting is 120 mg per dl. Post-lunch is 160 mg per dl, but post-dinner is 360 mg per dl, which is not controlled. Apply formula, divide 360 by 36, result is 10. Start the patient on 10 units of short-acting insulin before each dinner along with basal insulin, which is 20 units in this case. Increase the dose of pre-dinner insulin by 2 units on every third day if post-dinner sugar is not in target range. Thanks for watching.